Thank you so much. It's great to be back. It's always exciting. And I'll introduce our two guests today. When I was looking for a mohel, I called a colleague of mine and she unconditionally recommended Dr. Emily Blake. So that was my first one. But I also felt the need to go towards tradition. Rabbi Yitzchok Adler has been a figure in my life for a good 15 years now, ever since I lived in West Hartford. He was the rabbi under our chuppah. If I had boys, he would have definitely been the circumciser of my boys, probably, even though we have many great and qualified mohels in Montreal. So I figured I would invite him also to have two different perspectives. And that's the goal today, is to not only think about the idea of the mohel, but to think about the concept of a mohel in the liberal tradition and in the traditional communities as well. I'll correct you, Julia, a bit. Emily, when I spoke to her, I referred to her as a mohelet, and she said, mohelet is a very, it sounds more esoteric than it actually is. She prefers to be called just a mohel. And to which I responded, and I followed up with this with a Yiddishist friend of mine. Mohel is probably a Yiddish term if you're going to use it in that context, in which case, if one wanted to feminize it, one would call her a mohelte. So you can choose to say that or not. I think Dr. Emily is going to be called a mohel for the purposes of this, and Rabbi Adler is a mohel, or a mohel, or however he wants to be called. But thank you both for joining us. And what I wondered if we could start with is if you can both maybe start with Emily and then with Dr. Blake and Rabbi Adler, or Yitzchok and Emily, as we could say. Can you just tell us, before we get into the training that you each had, what inspired you to go into this job? It's clearly not a full-time job for many people. For both of you have other full-time jobs, but what inspired you to add this layer to your careers? So maybe start with Emily. Can you tell us what made you decide to do this?
Well, I'm going to start by saying this actually is my full-time career. I do this exclusively. And I'm going to say that it came about as a long progression for a lot of different threads in my life. So when I was little, I went through a period where I wanted to be a rabbi. This was before there were women who were rabbis. And maybe before or maybe right after I wanted to be a firefighter. So I was pretty small, but somehow there was something in that kernel that was moving to me. As a matter of fact, I was raised in a Reform household, but I convinced my parents that I should be sent to the conservative Hebrew school. So there was always something about religion that carried some meaning to me. And as I got older, I followed a totally different path. And I went to medical school. I became an OBGYN. I was doing circumcisions as part of that. And in the process of doing circumcisions, I wondered what would be the difference between doing it in a surgical form in a hospital or doing it in a ritual, doing it in a religious way. And from that, I went to find a way that I could be trained to become a mohel. And that was my initial move into that. Now, the conservative and the reform movements thought that there's a need to have some non-Orthodox mohelim, that we have a lot of variety in our communities, and not every family would be comfortable for an Orthodox mohel to work with, and vice versa, not every family would be comfortable to reach out to an Orthodox mohel. And therefore, they thought it'd be nice to train some people in our own traditions to become mohelim. And both the conservative movement through JTS and the reform movement through HUC have made training programs, but they didn't want to be responsible for teaching the surgical skills of it. And so what they did instead is to ask people who already were proficient in circumcision to come in and be trained in the halacha. So I actually ended up answering your first two questions combined, because I went from one to the other. But that was my pathway. Was I was doing circumcisions. I was a physician. I was doing it in the hospital. But I wanted to meld those two loves of my life, and that was the way that I was able to do it.
Okay, so we'll get more into the second part of the question later. But Yitzchok, can you tell us what inspired you to
Thank you, Avi, and thank you for welcoming me to this group. I consider myself a small town Jew, and that plays a lot into not only being a mohel, but much of what I do professionally. I was raised in Atlanta, and you might say, well, that's not a small town by any measure, but when I was a kid going to elementary school, Atlanta had about 20,000 Jews, which is 100,000 less than it has today. Small town. I went to yeshiva in Memphis. My first position was in Savannah, Georgia. Second position was in Chattanooga, Tennessee. And my first pulpit of my own was Jacksonville. All small towns. And when I got to Jacksonville, I had a sense that if I was going to make a difference in the community and in my congregation, I would have to creatively find a conduit to identify with younger families. The shul in Jacksonville was not a young congregation by any means, but it was my first chance at having my own pulpit. I reached out to a couple of doctors, made it known in town that I wanted to become a mohel. And that's actually where I started studying. Like Emily did, I think, Avi, I'd like to merge the two answers into one. I had mentioned earlier that the son-in-law of our cantor in Jacksonville is one of the most renowned mohalim in the United States, if not the world, Pesach Krohn. And I had the privilege of having him come down to visit in the summer and studied with him. But there were doctors who were very happy to teach me and allow me to be an apprentice under their guidance. Jacksonville, while it's a small Jewish community, is the largest geographic municipal area in the United States. And there was one pediatrician in particular who did most of the Jewish circumcisions in town. And it could sometimes take him out of his office for 90 minutes or 2 hours till he would clear his calendar, go to do the bris, get back to the office. As Emily would share with you, there are many phone calls before bris, there are many phone calls after bris. And in the 1990s, the doctor was making $100 on a bris and probably missing $200 in office visits. And that's really where I learned. I learned from doctors, pediatricians, and obstetricians in Jacksonville who welcomed me and made arrangements for me to get hospital privileges. And then Pesach Krohn helped me refine the technique to meet the standards that an Orthodox community would expect from a mohel. Ironically, between then and now, I can honestly say I don't think 5 families have joined any of my congregations because I was their mohel, but it has created conduits for me and indirectly benefited my work as a pulpit rabbi tremendously, because there are now many families in West Hartford, where I've been since 1995, who bump into me in the grocery store or in the mall and say, oh, Rabbi Adler, do you remember us? Or now that there's a pandemic and my wife and I are walking 2 or 3 miles in the neighborhood every afternoon, I'm meeting neighbors that I didn't realize were neighbors. And Rabbi, do you remember us? You bris my kid in Y2K, and it has helped tremendously build relationships. And if I could just add on, Avi, with your permission, to one of the comments Emily made, I have worked diligently, sometimes on the boundaries of what orthodoxy would consider to be acceptable or conventional, to reach out to families that might be afraid of an Orthodox mohel because it may be an interfaith couple, or it could be a husband and wife who are of the same gender, and they have worked through procedures available to them to bring a child into their home. And Rabbi, will you come and do a bris for us? And my answer is always and unconditionally, I will do a bris for any family that seeks to raise a Jewish child. How they do it is not why they've asked me to come into their home. They've simply asked me to facilitate something Jewish. And if I say no, I'm defeating the purpose of why I became a rabbi.
So if you can continue just a bit, can you tell us a little bit about the technical process that was involved? Go a little deeper into, when you decided, so how much was there observation? How much of the halacha did you have to learn, the Jewish laws involved in the process? What did that look like from you deciding right away that you wanted to do this to doing a circumcision on your own and becoming a full-fledged moil?
Great question, Avi. Just bring a little bit of humor into it. I get asked frequently by people, Rabbi, how long have you been doing this? And my answer is not very long, but I stayed at a Holiday Inn Express last night. When I was in Jacksonville, the doctor there that I made reference to was actually thrilled beyond words that I had interest, because like I mentioned, it was a favor he was doing for the community and it was becoming a burden to him. I did the halacha study on my own. And like I mentioned, Pesach Krohn guided me towards sources that he thought would be beneficial, not only Shulchan Aruch, but contemporary responsa. And I would just simply meet this doctor at families' homes or at the synagogues where the Brit would take place. And he always said, I have an intern that's studying with me, and may he come? And the answer is yes. This doctor had a very unique procedure. He would prep the baby behind closed doors in the nursery or in the shul in a library. And by the time the rabbi was ready to begin the ceremony, everything was already in place under a sterile drape. The clamps were on, the hemostats were in place, and all he really did was pick up the shield, the drape, make a cut, put it down. Rabbi would finish the procedure and the baby would be taken away, which of course violates halacha in a lot of ways. But the point is, it worked to my advantage, because after a certain amount of time, he would say, okay, Yitzchok, you see that there's 5 steps here. No one's around but you and me. You do step number 1, and I'm going to do 2, 3, 4, 5. After a while, he said, you do 1 and 2. I'll do 3, 4, 5. And that's how it went until one day I arrived at somebody's home, and waiting for me was a packet of tools and materials and a message from the doctor. The family said, he won't be here today, but he said you should call him when you get back to your office. So I did not know that I was flying solo until I arrived at that family's home. And it was the smartest thing that guy did for me, because I wouldn't have been able to sleep the night before had I known what that day was going to bring.
Emily, I assume that you had a very different process, or I shouldn't assume that. You know, what it sounds like is you train under a doctor, and one thing I always teach my kids, whether it's in the kitchen or whether it's repairing something in the house, I always tell my kids, the credo of the doctor or medical school is to see one, do one, teach one. And so did that fit in with your, which is exactly the way it sounds like with you, Rabbi Adler, and we can get into the teach one momentarily. What did your training look like from the medical side and from the halachic side?
Yeah, no, it's very interesting to hear Yitzchok, because I often wondered how you would be able to get that level of surgical training if you weren't able to be in a hospital. And it's not always true that somebody who isn't an MD would be able to be welcomed into the hospital. So that was really wonderful to hear that. Yes, you know, as a resident, I was trained by the other physicians in my institution on how to do circumcisions. And for a variety of reasons, I actually took it upon myself to basically do all of the circumcisions for all of the boys that were born during my many years of OBGYN training. So OBs in general are the ones that will do the circumcision of newborn babies in the hospitals. Some institutions use the pediatricians, but I think it's more commonly the OBGYNs. And so we would have 7,000 births. Half of them roughly would be boys. So I did an awful lot of circumcisions every year, and have trained people under me, but mostly have trained them in the surgical aspect, really, as doctors, not as mohelim. But yeah, same thing, did a ton of them, and they would watch you like an eagle and make sure everything looks good, and finally they would say, you're doing this fine, you don't need me in the room.
By the way, Emily, one of the ways I got into the hospital was in Jacksonville. One of the members of our congregation was an OB with, I guess, unique privileges at the local hospital where he practiced. And it wasn't so much that a rabbi was considered a medical student. I think there was a privilege extended to me as a courtesy.
Oh, I understand. And that's really wonderful. I have a sad feeling that it would be way harder to accomplish that today.
Oh, for sure.
But yeah, no, it's a great thing that they were willing to do that because it served so many different needs simultaneously.
So what happens then for mohels that do not have these types of privileges? How do they get trained?
Today, most mohelim are trained by a senior mohel. There are folks in this business who do a lot of, I shouldn't say business because it really shouldn't be viewed as a business. That's really not the right word to use. But there are those who are dedicated to this mitzvah, who are equally dedicated to training others to do the mitzvah. And there are folks like Pesach Krohn, for example, and others who do so many, who are so proficient and who are well connected, that I think someone who wants to become a mohel, if living in the right locale with access to these kinds of individuals, will be able to get that that mentoring like I got. But I can tell you, I never forget and always remind myself, I'm not a doctor. And if there's something I see, I say something. And if there's something that concerns me, I ask. And there's never a chance to undo what you've done. And I'd rather not do a bris than make a mistake.
I hear that. Emily, just to follow up when we spoke about before.
If something happened. Oh, sorry,
There
we
we
lost
go.
you for a minute.
What was the halachic training like?
So it was condensed. They required that we would show that we had proficiency in the surgery, not by going and doing one in their presence, but by having generally, somebody from the hospital who would vouch for our skills. And so I trained both at JTS and at HUC. I did both of those training programs because I'm a Jewish overachiever, right? So you have to do it all. The program that I did at HUC was one evening a week for like 12 weeks. And my program at JTS was one solid week. You were there from morning till night. And basically it was studying Torah and studying all of the rituals and learning the blessings and learning all of the rules of what makes it kosher and what makes it not kosher. It was, and I will also just say, it was the total opposite of going to medical school, because instead of it being, this is what we believe, just memorize it, everything was so layered and so interactive. And, well, you could look at it this way, but let's look at it this way. And what would this mean? And it was just, it was such a different approach. And it was really wonderful to have that sort of intellectual stimulation.
Fascinating. Okay, so starting with you, Emily, so you made a transition then from being an OBGYN into doing this full time. Maybe can you tell us a little bit about that transition? At what point did you start realizing to yourself this was your calling, your métier, the thing that you wanted to be doing, and the thing that you had enough clientele for to make this into the transitioned career? And what does your day-to-day look like?
Well, I think Yitzchok will.
And then we'll get to the difference of a pulpit rabbi who's doing this, as well. Yeah.
There is something so deeply moving in doing this ritual. You're coming into a family that is at a very crucial time. I actually often liken Brit Milah to a gateway drug. If you can make a family feel embraced in this moment, they will kvel in Judaism. That this will bring people towards Jewish ritual and to a Jewish life. And there is something so moving about doing that kind of work. So when I started, I was doing, I was actually a resident. I was doing my day job as a doctor, and every once in a while I would have a bris and I would go and do it. The transition, I will also say, from doing hospital circumcisions to doing surgery in somebody's home is profound. It's one thing to do something behind hidden doors, to do something when you know if you have a question or a concern, there's somebody just in the next room that you can pull in and ask, to going into a stranger's home and pulling out your surgical instruments. So that was a long learning curve, at least for me. It took me a while to sort of get the comfort in being able to do that. But I found it so deeply moving. The families that you work with have such interesting and unique stories, each one. And the opportunity to work with parents who are reasonably anxious, like makes sense, and to try to get them calm and to get them through this moment, and to at the same time make it feel like an incredibly joyous event, was intoxicating. I mean, I really found that there was something that just shook me to the core of being able to do that. So I did a long time where I did a balance. Every time I would, look for a job as a doctor, I would be negotiating with the other physicians in the practice to be able to have time to go out and do this. This is not a night job. This is not something you can do after sunset. It's not something you can push to the weekend. This is the 8th day, and it's the day. So you really have to struggle to make that acceptable to your coworkers, that you're going to disappear for several hours. And at some point I was getting a lot of calls and realizing I could perhaps make this as a full-time career. And that's what I have done.
Excellent. What does a day-to-day look like for you?
Day-to-day is totally crazy. It's a little hard to remember today because everything is so different in the time of COVID. But the day-to-day full range of what we do is we do a lot of counseling on the phone. You get phone calls from people who are either comfortable that they're going to do a bris, or they're struggling with doing a bris. I find that there's a lot of counseling that goes on to get people, and that varies with communities. There are some communities for which there is no question, I'm having a boy, or I had a boy and I'm going to do a bris. And there are many others that I think really cleave to that sense of Israel as struggle, and they call and say, I had a son and we want to do this, but we don't want to do this. And so it's that kind of struggle. So there's a lot of trying to get people comfortable with it. There's a lot of education of what this means we're going to do. For every family that I do a bris for, I write up a service. So I learn about the family, and that in turn allows me to individualize the service for who they are. It gives me a chance to say, well, if you're going to involve this person, perhaps we should involve this person as well, and to make sure that we think everything through before the final day, because you want that day to be something that really unites the family, that there's no tension accidentally sparked at the bris. So there's a lot of phone work before. There's sterile instruments which have to be washed and cleaned and sterilized. There's different ways that you can do that. At this point, I'm actually purchasing them from a supplier that sends me my particular kit of sterile instruments. I pack everything in a bag that I refer to as my bris kit. Thus, everybody thinks I'm bringing food, but I'm not. On the day of, I travel to wherever it is. I get there early, and my pattern is to pre-medicate the baby. So I make a sugar solution with a little bit of Manischewitz.
Let's hold off on that for a second. Okay. I want to get to, before we get to that, Yitzchok, your day-to-day is dealing with a lot of different life cycles, right? The first of which generally is dealing with circumcision, with bris. In addition to bar mitzvahs, weddings, funerals, what is the day-to-day like look like from the perspective of you as a moel, in addition to being a public rabbi?
Well, unlike Emily, for whom it is full-time, it really is part-time. I will call it moonlighting, except we don't do brises at night.
At night, as she said, yeah.
So it's basically being available as people need. What's interesting is some folks will call after a baby's born and say, Rabbi, we need a bris in 2 days. Can you make yourself available? Are you available? And I always prioritize this. And even folks who attend adult ed, for example, at the shul, a parsha class, will understand sometimes I've got to be flexible and they're flexible with me. More often though, I'll get a phone call 2 or 3 months in advance. We know we're having a boy. Are you going to be around in July? And my answer always is yes, because I need them to know, sort of like Emily said, our job is this could be entree for some folks that are not affiliated with the Jewish community. And if the rabbi's answer is no, I'm going to be on vacation, that very well might be the end of any chance of that kid having a bris. I don't know that they'll make a second phone call, or if they will say to me, can you find us someone to stand in for you? If it turns out that a baby is born and for whatever reason I'm not available, then it is my responsibility to convince them to trust me to find them a mohel, and I always can, because there are folks around, not necessarily nearby. Emily, I don't know where you live that you do this so full time. I can tell you that I'm the only mohel that I'm aware of who's a rabbi in the state of Connecticut now, and there aren't that many brises taking place. We have a population problem in New England, but that's secondary to this particular conversation. The congregation values that I do it. People take a lot of pride in the fact that their rabbi has these connections, and it really has strengthened my conviction in the work that I do, because every family that I meet has a different story to tell, a different journey that's led them to this moment. And my responsibility, aside from doing the best bris I'm able to perform, is to make sure that when I leave that house, people feel more relaxed, better, and more proud of their faith than before I arrived. Not only that, something I've also learned over the years, and it has helped me deal with interfaith couples, and that is from the context of a Jewish community. We always think about the difficulty that Jewish parents have when their kids marry out of the faith. We don't think about frequently the other side of the coin. What's it like for Christian grandparents, for example, to be invited to their daughter's home or their son's home when a rabbi is going to come in and do a Brit Milah? And I see these opportunities as particularly important, because it gives me a few minutes before I actually begin to talk about the universality of Old Testament scripture, Brit Milah being Abrahamic. And I don't talk a lot before bris, and I don't talk a lot after bris, because before bris people are nervous. And like Emily said, there are certain techniques we employ today to mitigate the child's discomfort, and a lot of that's got to do with timing. And I make families aware that if we say a bris is going to take place, say, at 11 a.m., it's not an inconvenience to me to wait till 11:30, but it very well could impact how the baby responds to the bris if we don't do it on time. And similarly, afterwards, I must tell you, I become very uncomfortable when rabbis feel a need to chat with the assemblage and talk for 15 minutes afterwards, and the baby's crying, and the rabbi says, oh, he's not really uncomfortable, but he's crying. Get it over with so that mom and the baby can go to another room and she can comfort her son. I think it's really important for clergy to realize that their attendance at a bris is to facilitate a simcha, but not to remind everybody that they are the rabbi.
Amazing. Can you tell us a little bit about, or even just walk us through the steps from when you get that first phone call? Assume you get a call. I always used to tell couples, call your parents first, and if it's a boy, then right away call the mohel. to make sure that the time is booked. From that point on, and from the pre-visit all the way through until the aftercare, can you just give us briefly what are the steps involved? Because I know as a pulpit rabbi, I'm just as lost as everybody else in that room as to what's going on. The thing that I get to do is I often get to name the baby, you know, if I'm there, if I'm a rabbi, if I'm the couple's rabbi, but that has nothing to do with the technical aspects. So walk us through those steps, and then Emily, maybe you can help us in terms of contrasting what that might look like from your perspective.
Yeah, well, number one, I want to remind you, as you know, Avi, West Hartford is not a large community. Yesterday, I went into Massachusetts to do a bris. I can't always do a pre-visit. If folks live in town, I'm happy to go to their house. I want to be introduced to them. I want them to know who I am. I don't want to be a stranger when I walk in. But yesterday I had to drive 100 miles to do a bris, so everything that was discussed over the phone and in anticipation. But nonetheless, even those telephone conversations are important, because parents are giving over to the mohel their most precious blessing, and that's their child. And like I said before, you can't fix it if you don't do it right the first time. So it's very important to establish a sense of rapport and trust. The parents have a right to know who you are. And I encourage local families, particularly if they call me 5-6 weeks in advance or a few months in advance, let's get together, come to my office, and let's get to know each other. When the baby's born, I do say, of course, call your relatives first. That's the most important thing. And then call me, because they're going to want to know, when is the bris? So we've got to work it out. We have to make sure that they are calculating the 8th day properly in terms of when is the baby born. It's near sunset, Shabbat, cesarean section, the variety of factors that go into play. The kid that I brised yesterday, for example, wasn't born on a Tuesday. He was born more than 8 days ago, but when he was born, he was put into the NICU and he was on an IV. And I had to explain to the parents that we don't even begin counting 8 days until the child demonstrates adequate health. And if the child has an IV, by definition, that child's not ready for a bris. I give them a shopping list. These are the things you need to provide. This is the arrangements I need in your home or in the shul or in the clubhouse, wherever it is that we're going to be doing the bris. These are the arrangements I need. This is what I'm going to bring. And I also send them in advance and review with them once I'm there before the bris, how to take care of their son after the bris. Because frequently the kids are agitated. The parents, even if there's a facade of calmness, are tense. And as soon as that baby is off the pillow, mom wants to hold her son and she wants to comfort her son. And I don't want to get in the way. And I will have more of mom's attention before the bris, and there's clarity about exactly what to expect, not only through the ceremony, but also what the week after the bris is going to look like as they change diapers, and they shouldn't be horrified by what they see.
What does when you walk in the morning of the bris, and then I'm going to promise Emily, I'm going to let you, you know what, why don't we get to you, Emily? Starting from when you walk in and you have your bris kit with you, do you ask the families to have a shopping list as well, or do you provide everything? I assume that even if there's a shopping list, you probably have backups as well to carry with you. What does that look like? And then from the moment you walk in, walk us through the steps, help demystify it, pull the curtain back, don't hold back any of this, anything.
So there's a lot of upfront on the phone, working with people, and I too have a very large catchment area. I go up to Connecticut, I go down to Philadelphia, so I do not see people beforehand. I meet them when I walk through the door. I send them an email that has an attachment that is the list that Yitzchok was talking about. Please make sure you have these gauze and these ointments and all of that. And at the same time, I carry all of those items in my brisket because somebody forgets something. So I come, in part because I do this full time, I invest a lot of time in each bris, and I get there about an hour early, and I spend that preliminary hour trying to get the baby schnockered, basically, trying to get him sleepy and comfortable and calm So it turns out that all of the neurotransmitters work exactly the opposite in the newborn window than they do later. So giving a newborn sugar will make him or her fall asleep. So I come early and I make a sugar solution with some Manischewitz wine added. And I give that to the baby in advance. And honestly, about 90% of my babies will sleep through the moment of circumcision, which the families then feel very relieved about. So I come early and I get all of that done. Now, again, I don't get to see the babies, a week before, but I do ask them to make sure that the pediatrician believes that everything is normal. When I get there, I then also do a full physical exam to make sure that everything is appropriate. So as Yitzchok mentioned, there are some medical conditions for which you should not remove the foreskin, because that foreskin will be used later to do a surgical correction. It's for instance, hypospadias, where the urethra doesn't migrate all the way to the very tip of the penis. You want to leave the foreskin for that reason. So I want to make sure that I am not doing anything that could have negative ramifications. If I see that, we postpone the bris until they get fully evaluated by a urologist. But assuming everything's okay, then we move forward. So I set up my prep. I get the baby all schnockered. You have to also take control of the room. You have to figure out where you're going to have the bris, where people are going to be waiting and people will be participating. Make sure that they have copies of the service. I make a service for each family so that they can all participate in that. Make sure that there's wine served. And again, the way that I do it is I like to do the circumcision very early in the flow of the ceremony. So somebody has the great honor of carrying the baby into the room. We have that person carry the baby in and we welcome him in for that. Somebody else has the highest honor of the bris, and that is to be seated in Elijah's chair. They are Elijah's representative, somebody who is holy and moral, and somebody that this child should aspire to emulate, gets that kind of an honor. So you have somebody in Elijah's chair. I actually can do it on the sandak, the one in Elijah's chair, on their lap, or I can do it on a table. Sometimes a table is less stressful both for the sandak and the parents. So I'll do it whichever way the family feels more comfortable with. I ask the parents for permission to do it on their behalf because it's their obligation, not mine. We or I will say the blessing, do the circumcision, and then the parents say a blessing that follows. After that, I hand the baby to the mom or parent, I guess, not always the mom, but mostly always the mom. And then we start on the naming, but you can feel the level of anxiety really fall in the room. And because 90% of my babies didn't cry during the cut, probably 80% won't cry during the rest of the ceremony, people can feel more a sense of relief and a sense of simcha, a sense of this joyous moment of welcoming this child into the family.
Excellent.
I don't know if you want to do this after, but I also stay for about an hour afterwards.
Mm-hmm.
I review the post-op care, which Yitzchok also said he reviews the post-op care, but I have the luxury, or I make it a point, that I stay until we do the first diaper change and actually show them my post-op care in situ, exactly how I do it.
And this is not just an excuse to eat. For you to stay a couple
I'm usually running around so much I don't get to eat, but I usually will pack up a little something to go. So there, yes.
Yitzchok, do you have anything to add?
What career can you possibly have where you go and you have this joyous moment and they pay you and they feed you? It's the best.
Weddings, I can tell you.
That's true, yeah.
Yitzchok, do you have anything to add to
Well,
difference in how you do things?
Very, very similar. Some parents, some families are very traditional and they want the baby held on the lap of the sandik. Some families are less traditional and are comfortable allowing the baby to be placed on a pillow on a table, which quite candidly is my preference because it's higher. I don't have to bend down as far, and it gives me the privilege of being more liberal in terms of who will be the sandik. Sometimes they want to honor a grandparent and maybe that individual's a little bit shaky, a little not so secure. If the baby's on a table, the baby's not going anywhere. It's good for the mohel and it's good for the baby, but there's no problem on a lap if they assign the proper person who is capable of meeting my needs while the baby's on the lap. One of the ways I try to engage more people in the ceremony is, rather than what Emily does, having the baby get the sugar before the bris, I have created an honor that goes side by side with the sandik I call the bartender. And that person will actually give the baby grape juice on a gauze pad while I'm working. And I got to that point because in helping families put together the bris, they will sometimes have questions. Who do we honor? We've got two sides of the family. This is the first grandson on both sides. If someone's going to be the sandik, the other dad's going to be unhappy. How do we deal with it? And by creating as many honors that put as many folks into the camera spot as possible, it helps families navigate that particular issue. And also something that Emily talked about with the sugar and the manischewitz is that parents really appreciate when a mohel demonstrates concern for the baby's comfort. I can't guarantee that my kids don't cry 90% of the time, but I can guarantee parents that if they do what I ask them to do, it will mitigate the pain. And my responsibility to complement that is without rushing to the point of being sloppy, but to get the bris done as quickly as possible, because the faster the tools come on and the faster the tools come off, the faster this is over and the pain is done. And when a baby cries after the bris, the truth is he isn't in pain anymore because the bris is done. He needs to be comforted and relaxed. And
amazing.
What we need to do is respect the guest of honor's needs and place everybody else's needs secondary.
So we've been talking about 8-day-old children, or briefly, shortly thereafter. There are children for any number of reasons, and we don't have to get into them now, for medical reasons, for other reasons, don't always have the opportunity to have a circumcision right away. We often get into adults, sometimes for conversion purposes. Emily, is this something that you do as well, or do you only handle infants? And Yitzchok, I know that you have done work with, beyond 8 days. Can you tell us a little bit about that? So Emily, do you do circumcisions for adults or older children? And yeah.
I do circumcision only on newborns. Yeah.
Okay.
Within about the first
at that point, you need a urologist.
Weeks of life.
Yeah. Yitzchok, do you get involved in that in some way?
Well, the answer is yes, but not frequently. Like Emily mentioned, if a child is born with hypospadias, doing a bris on the 8th day is simply not the right thing to do. But at some point, that kid will have to be corrected through the plastic surgeon, the pediatric urologist. That'll happen most commonly in a hospital. And the family may ask if it's possible for the mole to come in. And under those circumstances, I will go in. I don't claim to have the skill or the technique to do what these doctors do when they literally cut and cauterize and stitch all the way around. But I will go into the operating room and begin the procedure with the doctor, make the blessings, come back out, then let the parents know that everything's going to be fine, and bless the wine, bless the name, and stay with them until the doctor comes out and says, we are done. Mm-hmm. When it happens with an adult, it's not all that terribly different than I would just describe with a kid that might be 11 or 12 or 13 months old getting a hypospadias repair. And then it really depends doctor to doctor. There are some doctors who do it in the hospital, and there are some doctors here in Connecticut who say hospitals are the worst place to be, and long before COVID-19. And they will do it in their own offices where they have a better sense of control over the environment and infection control.
Okay, so you're both coming from very different perspectives, right? Can you, and this, we've had a couple of questions come in the chat about the nature of intactivists, which are those who believe that, we shouldn't be performing circumcisions on children either at all or until they become past the age of consent. They think that, that it is an unnecessary surgical procedure, et cetera, et cetera. And for that, there's any number of websites or articles that we can look at online. Is there something you say to them, but usually using that as a jumping off point for something a little larger? And I know that I want to get mindful of the time of all of our participants. So if we can try to keep it relatively brief, although it's the hugest question of them all. Can you tell us about the theology of circumcision as you come to it from a liberal perspective, from a traditional perspective, and how that impacts the work that you're doing? You talk about, Emily, about the joy of it, and you were talking about the commitment to Yitzchok and the biblical nature of it. Can you expand on that just a little bit in the nature of that and why you think it's important, especially in the face of this movement of intactivism? Emily, start us off.
Okay, all right. I have to start by acknowledging that the intactivists have really come up with a wonderful name.
Yes.
And I have actually heard the theory that they came up with that name intactivist before they even knew what claim they should be making, because it is just such a wonderful name. But
it's better than brisket.
Yeah, that's right. It's better than brisket. So there are a lot of different reasons why people get involved with the intactivist movement. And the thing I mostly do is I try to find the meaning or the reason why the family I'm dealing with might be questioning it on that regard. So there are people that become intactivists because nothing should be changed. But the truth is that we change our children all the time. That's the whole question about vaccinating or educating. And you as a parent are going to make a lot of decisions that will permanently change your child. That's your job. That is what you're supposed to be doing. There are some people that are worried about the pain, but the truth is, as Yitzchok and I have both said numerous times here, we can do a lot of things to make this not a painful event. And if we can minimize the pain, if we can make sure this baby is not actually experiencing any additional pain in his life, then that logic doesn't really hold true. So for instance, the most painful part of the whole bris, in my experience, is when you break the adhesions underneath the foreskin, when you pull it all the way back. And because that's the worst experience of this whole thing, it's not actually the cutting. The cutting is often not the painful part of the experience for the baby, but pulling it back, even if you're not doing a bris, or especially if you're not doing a circumcision, you have to clean under there at some point, and you will have to pull it back and lice those adhesions. So the concept of, I don't want to do it because it's going to hurt the baby, is a fallacy also. And the third complaint that I usually hear when people are calling saying, well, I don't know, I've been hearing from these intactivists and I'm not sure that I should do it, is that it lessens a man's pleasure. Well, I'm going to posit the observation that a lot of men who are circumcised still seem to have quite a bit of pleasure at sex. So I don't think it totally obliterates that enjoyment. Furthermore, because there's such a difference in risk of acquiring and transmitting viruses, most specifically in this case, the virus for AIDS, the HIV virus, there's been quite an effort in Africa to circumcise adult men who were not previously circumcised, but to do it so that they are less likely to contract and less likely to spread HIV, which means that finally we have a really large cohort who can talk to us about the difference in sexual pleasure if you're circumcised and if you're not circumcised. And the studies show that about 40% will explain that the sexual pleasure is greater without being circumcised, and 40% will say the sexual pleasure is greater having been circumcised, and 10% are sort of like, doesn't really make a difference. So the claim that we don't want to circumcise because we're taking away somebody's sexual pleasure is also a fallacy. Those are how I deal with those issues.
Yitzchok, help us with the theology of Bris. And
I'll add a little bit, but Emily was just articulate and right on, spot on. Number one, no mohel will ever do a bris against the consent of parents.
Right.
And when there is a difficulty, that's where we become educators, to try to help people find a sense of comfort where otherwise they might not. When folks say, I'd rather let my kid make the decision as a young adult, my response to them is, be aware that if we do a Brit Milah when your child is 8 days old, he'll never remember. The healing is relatively quick. There's no cauterization, there's no suturing. Wait till your kid's 15, 16 years old, and then they're going to go through it like that, and they're going to ask you, why didn't you do it when I was 8 days old? Look at what you've put me through. The shame, the trauma, the difficulty of it all. It's much more compassionate for a Jewish family to fulfill the mitzvah than to wait. An option that I do provide, if I sense that there's really recalcitrance and this kid might not be brissed, a very unorthodox option that I say to them is on the table. If you're not willing to have me come to your house and do the bris on the 8th day, please consider letting the doctor do it in the hospital before the kid comes home, and then you've got all of the surgical and medical guarantees in place. And I will do a hatafat dam when your son's home and when your son's healed, and that's virtually non-invasive, just a tiny little prick. But at least then this child will grow up having been circumcised. The rabbi's been there, a blessing's been made. There's a sense of simcha to it. And I keep that in my bag of tricks simply because my goal is to make sure that every Jewish boy is circumcised and it's done in a way that meets the needs of tradition. And if we don't get halacha platinum, at least we get halacha silver or bronze, but we keep people engaged with tradition, which is ultimately what this is all about. Because if we lose kids at this age, it's a downhill slide from there.
Excellent. All right, I want to wrap it up, but I have a few rapid fire questions that we're going to throw at you just to sort of get all the last pieces in there. What does a bris cost?
It depends where and when. The answer is, I will do a bris for no money at all if it's a difficulty for the family. And I always tell them this is my fee. And in the Connecticut area, I get between $500 and $600 a bris. If I travel, that will affect the price. And if I sense that people are hesitating or swallowing hard, I say to them, we're never going to let money get in the way of a mitzvah. If you cannot afford it, I'm still coming. And whatever you can afford, that's good enough. And let's just go forward.
Emily?
I agree with all of that, except in this area. Bris runs somewhere around 900 to 1,000.
Oh my gosh, have I got to change my fee scale?
You got to come down here.
Where is here, Emily?
I'm in New York. I'm in New York City.
The actual bris itself is not different in terms of a traditional versus a liberal tradition. Can either of you speak briefly to that? Like the actual cut itself, the circumcision, any of the preparations and stuff like that, is those pieces tend to be the same? Or is there significant differences enough to make a difference?
When I trained, I learned how to use the mogen and I learned how to use the gamko. I would never do a bris with a gamko. I only do a bris with a mogen. It's only 4 pieces of metal to the whole procedure. And if the family is very traditional and they don't want me to lock the mogen, I leave the mogen unlocked and I have ways of controlling the bleeding. though I always encourage them to allow me to use the Mogen properly. What we didn't talk about, Avi, running out of time, we'll have to do this again. And Emily and I've enjoyed this. I would love to continue. Is the question that some families have about Metzitza and how we deal with that, which I think everybody knows is strongly discouraged, even independent of the COVID-19 issue. But there are some populations that still demand it. And there, a mohel has to tread carefully because it's his health or her health and not only the baby that's at stake.
So I stayed away from that deliberately on purpose. I didn't want to talk about it, but yes, if there's a demand, I will gladly have another hour just on that issue. Emily, are there any differences? And maybe as a doctor, can you tell us very, very briefly what are these two different types of clamps and different types of procedures involved?
So I trained with both also because I was really interested in circumcision. So when I was learning it, I did thousands and I used both clamps. There is, and I actually have them here. So this is the traditional Mogen, I guess that you can see. It opens a little bit. You slide the foreskin through. You lock it as the tradition for using the clamp, but the Mogen shield does not lock, so you just leave it pinched a little bit, but not so totally locked. And then the flat surface, you just cut straight across. This is the Gomko. The Gomko is much more intricate. It's got this bell that has a little hole in the inside, just like a bell, so it sits right over the penis, and then you bring the foreskin up and over that metal and you lock it into place. Now, having learned them both, there was a long period of time when I actually brought them both with me when I would go to a house and I would ask the families what they prefer. But the truth is that the times when there are accidents, complications in doing Brit Milah, they occur with the Mogen. And so I ended up starting at the exact same place as Yitzchok. I ended up on the other end, and now I do exclusively the Mogen. To me, we strive never to take any unnecessary risks to protect life, to protect health, to protect safety. And so this clamp being slightly more safe than the other is enough of a reason for me to have shifted in that direction.
Excellent. Our last question, we asked them last week, I think we're gonna ask everybody, although these, you can be as graphic or not graphic alike. There's gotta be a story from the annals of your careers as a mohel that really stands out as, I can't believe that is over the top. What's your Ripley's Believe It or Not mohel story? Yitzchok.
Oh, so many.
That you're willing to share publicly.
You know what? So many of them are stories. I can tell you there was once, going back to what we talked about a few minutes ago, there was a family maybe like 15 years ago where the dad absolutely wanted the baby to have a bris and the mom absolutely did not want the baby to have a bris. And it was both Jewish parents. It for sure didn't happen on the 8th day. It didn't happen on the 10th, 12th, or 15th day. It was a family that lived in New York State, just across the state line from Connecticut. And as it turns out, I was driving down to JFK to pick up my daughter who was coming home from a gap year at a seminary in Jerusalem. And we were at this deadlock. And I called the family. I said, look, I'm driving to New York tomorrow. If we're going to do a bris, it's going to be tomorrow or the chapter is closed. And I can arrange to come through, be at your house, do it under your circumstances, your conditions. I just need to know by 12 o'clock tomorrow, yes or no. At 11:30 that morning, I got a phone call from the dad who said, my wife has consented, the bris can take place under the following conditions. Number one, it cannot be in our house. Number two, there can be no guests. And number three, I'm not going to be there. So the father said to me, you start driving. I'll call you from the road and tell you where to meet me. He called me up and said, I've made arrangements to get a room at the public library. When you get there, just tell them you're looking for me. We went into this room in the library, closed the door. It was just the baby, the father, and me. I did the bris. The baby was crying. And as I was literally closing my bris kit to get on the road, the librarian came rushing into the room saying, we have a separation of church and state in this county. You can't do ritual things in this library. You must leave now. And I said to the lady, you're 100% right. I'm out of here.
Amazing.
Beautiful.
Emily,
All
close us
right,
off.
so I have done a number of Britot on pool tables, but I'm going to say that my weirdest one was I got to do a bris in a boxing ring.
Oh my.
Okay.
You got me.
That's a story for another time.
That was. They were both
Amazing.
Jewish. The dad was a big time boxer, so he wanted to do it in a boxing ring, and we did.
Okay. That's an amazing moment. Thank you so much, both of you, for taking the time, for enlightening us into this ritual, which many people have been a spectator in, but not always have had the insights into what's going on. It's really been an honor. I feel more enlightened, and having been a participant, an active participant in dozens, if not hundreds of brises, I now know more than I've ever known before. And it means I'm sure that everybody else is also. So I want to thank you both for doing this. I want to invite everybody in the room here. Thank you, and to come next week. Next week we have David Zvi Kalman, who is a book publisher. Print O Craft Publishing is a really offbeat but amazing Jewish publication society, and we will talk about the idea of what does it take to bring a book to life.